I'd like to say to students, welcome back and Happy New Year. I'm delighted that we are now the King's College London GKT School of Medical Education. And we should also be justly proud of our recent performance in the Research Excellence Framework, which saw clinical medicine rise to third in the UK. But we're not complacent. We must always strive to improve education and support we provide to students. I want to help students to become the best possible doctors they can. Safe and effective from day one. Lateral thinkers capable of pushing the boundaries to improve patient and population health. The medical leaders and innovators of today and tomorrow. I recognise that university and exams in particular can be stressful. We want students to have a happy experience here at the GKT School of Medical Education. We've already made a number of changes and most recently published the curriculum map together with the clinical skills map. These set out the high-level objectives, what we expect of students at the end of each phase and the end of each block of study. We hope that this will serve to demystify what is expected in exams. We're also rolling out formative OSCEs and formative written exams, particularly in the clinical phase. I'm also about to introduce a regular communication to keep students in the loop around recent developments within the school, and that will supplement the weekly bulletin. We expect students to fully engage with the learning opportunities available to them, and for our part we will do all we can to help students flourish. Students should let us know when things fall short so we can remedy issues quickly, and I'd like to thank students for letting us know about no-shows and cancellations. This has helped us to understand what goes wrong, and it would appear that the number of no-shows and cancellations is going down. I recognise IT and in particular Wi-Fi is causing problems, and the link to Lewisham has been a major issue for some of our students. We have raised this at the highest level in the university, and we need students' help to keep us informed about what's working and what's not working. IT have a dedicated link to alert them to issues and to not spots, a new phrase which I've learned over the last few days. With your help, hopefully we can turn this around and ensure that you have a positive experience. The next few months will see a lot of discussion around the NHS as we approach the general election. Politicians will set out their plans as to how they're going to enhance services in these straitened economic times. There is increased recognition that we need to shift focus. While it is vital that we recognise, assess and manage the acutely unwell patient, we must also develop our skills to help patients manage their long-term conditions. Managing risk is fundamental to how we will work with patients and the public to manage their long-term conditions. This is a core attribute of being a doctor. To be effective at managing risk, we need a paradigm shift. We need to move from a traditional worldview which juxtaposes ill versus unwell, normal versus abnormal. What we are learning from molecular biology, from big data, is that we need a much more sophisticated conversation with patients and the public to recognise the complex interplay between genes, behaviours and the environment, and engage them in identifying the modifiable risk factors, helping them to take control of their health and work with them to reduce the impact of long-term conditions. King's is at the heart of these debates, contributing to discussions around how we should structure the health service to best serve patients, also pushing back the boundaries of knowledge with pioneering developments and discoveries in the life sciences and medicine. But we can all contribute to this debate because we're all committed to improving the lives of patients and the public. Finally, I'd like to say to students, I'm looking forward to meeting up with you over the next few months at GKT Musical Theatre or the Macadam Cup. The entire team is committed to ensuring that the GKT School of Medical Education is the dynamic and supportive learning environment that helps us all be and become excellent doctors.